Well, hello, everyone. It is Dr. Brandy B. Come on in, come on in. It is February the 3rd. Oh, my goodness. And I'm so excited, y'all. I missed you last week. I thought about you all. Just could not get in there. These Fridays and trying to squeeze in Friday appointments and everything else is a lot. But guess what? We are here today. Come on in, y'all. It's February. Oh, my goodness, the month of love. Come on in, come on in, invite a friend, and come on in. It's Dr. Brandy B for Focus on It Friday. Come on in, guys. I've been missing you all. It's hot in here. I'm about to turn this air conditioner down. It's hot, but it is not the love. It is just warm in the vehicle. It is warm in the vehicle. Come on in and tell me that you are here. Say hello. Hello there, Philando Parker. Listen, guys, if you all need your TV hung and you are anywhere in Alabama, I think Mississippi and Tennessee, then you need to be checking out iHang TV. TVs, I think it is, with Mr. Philando Parker. So you go ahead and drop um, your email, your phone number, whatever it is that you want the people to know and how they can reach you. Drop it in the chat so that the people can know how to get you and get their TVs hung before the big day comes for the big game. Okay, this month, Super Bowl, you want your TV hung. And also for any romantic movies you may want to watch with the one that you love if you have kids and you can't get out. So that is Mr. Philando Parker. We love him at iHang TVs. He is the owner of iHang TVs. We've got Auntie Julia on the line. Hello. We've got Miss Stacy, my nurse. Y'all know I love my nurses. Hello, hello. Mama Diane is watching. She says hello. Mr. Philando has put it there, iHangTVs.com, 205-326-6884. Make sure that you need your TV hung. And yes, they hang the wires. That's what he says on his commercial, guys. If you're around Birmingham, you've probably seen a Max bus with it on there. You may have even seen a commercial. But yes, he hangs TVs, and yes, he hangs the wires. I believe they hung a TV for my mama, too. Yeah. Got to get them over at our house as well. But y'all come on in. We've got some good stuff to talk about today. Over here at Focus on It Friday. We've got 4 people watching. We're so excited. Make sure, loving the red lipstick. Thank you, darling. That's my nurse, Stacy. She says she is loving the red lipstick. We've got Miss Crystal Mullen Johnson. I see that she is watching. That is our therapist. Friend, sorority, sister, everything. Miss Crystal is here. Go ahead and tell the people how they can find you. Y'all know I just love sharing and spreading the love. Miss Crystal, if you are needing a therapist, she can hook you up, guys. She can hook you up. I hear Miss Lady Wu in the background on my radio. She can hook you up. I have so many friends that are therapists, and we're actually going to be talking about that today when we're going to be talking about the link between all these amazing things that we share at Celebration in the month of February. I didn't put Super Bowl. I forgot that, but Super Bowl fits right in with what we're going to be talking about today. If you don't mind, go ahead and share the video. Just share it. Your friends will watch. They'll see it in passing, and they can know that we're here, and they can come on as well. My cousin Latina is watching. Thank you so very much for watching. Thanks so very much for watching. Crystal, where are you moving your new office so that the people can find you? I want to know where to find you. I never knew where your first place was, but I'm excited to know that. Happy Friday, she says, and happy Friday to you. I'm going to go ahead and get started. I'm Dr. Brandy B., your triple board certified pediatrician, adult psychiatrist, and your child and adolescent psychiatrist. I am an ADHD expert, the author of the best-selling book, Shine, Understanding ADHD, so your child can be a star. I am a wife, a mommy, and a friend to so many, and I advocate for kids to get whatever it is that they need so that they can do their best and be their best in the classroom and in life. So we want to talk about a couple of things today. We know February is a big month. It's kind of like me, I guess. It's small but mighty. That's what February is. It is small but mighty. Small but mighty. Hello, Ronnie and Beth Rudy. So nice to see you all again. Thank you so much for coming to Focus on It Friday. We are tardy, but we are present, and we're going to get this party started right. So February is small, but it's mighty. A lot of stuff going on in February. February 3rd is National Female Physician Month. Yay, go me. Of course, February is Black History Month. Yay, go Black people. and all the great things that we've done. Yay, so exciting. What else is February? February is Valentine's Day. Oh, my goodness. So whether you're booed up, you want to be booed up, you're thinking about being booed up, somebody that you want to be booed up with is booed up with somebody else, that could all lead into what we're going to be talking about today, child, because that sounds like a situation. As Jada Pinkett Smith would say, it sounds like a, what did she call it? She called it a, oh my goodness, what did Jada Pinkett Smith call it? She didn't call it a conundrum. She called it entanglement. Yes, a Valentine's entanglement. Somebody might be in. What else is going on in February? We got National Female Physician, Black History, Valentine's Day. We got the Super Bowl, and whatever the other things were I listed in the subject, y'all. I can't even remember. I feel like it was one more, maybe two more. But anyway, all these things are going on in this month. And what is the common link? What's the common link? The common link, American Heart Month. And today is Go Red. Go Red. Go Red for women. How could I forget? So today is Go Red for women. February 3rd is always National Female Physician Day. Valentine's Day, Black History is the whole month. American Heart Month, we got to protect our hearts, and also the Super Bowl. So what's the link? Patricia Pruitt, good day. I'm here. Thank you so much for coming. We were waiting on you, girl. We're so glad you made it. So what do all these things come in and have in common? Because that's a lot of stuff. Again, February is small, just as my 4-year-old Faith says, a little bit. It's just a little month, but it's jam-packed with so much stuff, which can be stressful in and of itself. You got to keep up with all this stuff in such a little bitty month, but jam-packed with all kind of stuff. And what's the common link? The link, guys, can be stress. So how? Well, if the Super Bowl, that's kind of stressful. You want your team to win, especially if you put some money down. I mean, I'm not saying that you have, but if you got some money riding on it, that's stressful, okay? What else? National Women Physicians Day? Being a woman in this field and is enough. That's stressful. And depending upon your specialty, if you're a neurosurgeon, heck, if you're a pediatrician and you're trying to figure out if you're going to get peed on, that could be pretty stressful. Valentine's Day, we already said for some people it's stressful because what? They're trying to do too much. Or some people are like, I'm stressed out because Valentine's Day is coming again and I still don't have anybody to give me a little do you like me check, yes or no note. And I'm 56. That could be stressful. What else is stressful? Black History Month, right? Being in this country, or any country for that matter, that's not, somewhere else, that can be pretty stressful, right? I always am reminded of when I found out I was pregnant with a boy, a black boy, and I was like, oh, Lord. Everybody said, girl, you just want a girl. I'm like, no, I just want a boy that's not going to be gunned down, right? That's pretty stressful, raising black boys. I can't talk to everybody else about that. Even if they're black and they don't have boys, they may have husbands and daddies and brothers, but if you don't have a black son, you may not know what that's like. And then what else is stressful about this month? American Heart Month. The whole premise about what they're talking about is reducing your stress, reducing your fried fatty foods, reducing your weight. Why? So that you can live a long, happy, heart disease-free life free of heart disease. And what else? Go red, right? Go red for women. Why do we even care about going red for women? Because women are oftentimes one of the highest growing, highest populated groups of people for heart disease, heart attack, and they don't even know it. Why? Because it just feels like heartburn. You got a little pain in your chest, got a little pain in your jaw, and if you miss it, you won't know that you're actually having a heart attack. So what does that have to do with me and Focus on It Friday? I am so glad that you asked. It is because the question comes up all the time. Do I need to see somebody? I'm stressed out. I don't know what to do. This week for me was a crazy week. Had 2 days off, and still the week ended up just being bananas. Why? Because of stress. And so I got this question yesterday. I think I need to take my child somewhere, and I think I need to go somewhere too. I just don't know where to go. So I said, well, guess what? We're going to talk about it on Focus on It Friday. So where do you go when you're feeling stressed out? That is an excellent question, and I am so glad that you're here to join me as I explain it. So, first thing you need to do is say, hey, I think I need to go somewhere. Now, if you listen to me all the time, you should know the answer to this question. Who all do I say? Who are the people that are the most likely candidates for therapy? Who? Go ahead and just type it for me. I'm going to wait on you just a few seconds. Who is it that I say can be a great or is a great candidate for therapy? If you've been listening, Miss Vikita Mason, thank you. Miss Paula Moore is watching, thank you. Go ahead and tell me who is a great candidate for therapy. If you've been watching me all the time, you know the answer to this. You know it. Who's a great candidate for therapy? Y'all got shy on me. Y'all got shy. Come on and let me know. Who's a great candidate for therapy? Oh, I realize there's a bit of a delay, so I'm just going to wait. Who's a great candidate for therapy? I say it all the time. All the time. All the time. All right, we're going to give y'all 10 more seconds. Nobody knows? I know somebody knows. Come on, one person. Go ahead and tell me. Who's a great candidate for therapy? One person? All right, well, I'll go ahead and tell you. Everybody, 100% of, especially anybody who is older than, early childhood is a great candidate for therapy. In one of my mommy groups, guys, I was floored because yesterday one mom of an 8-year-old posted that her child was in his first therapy session, and then another mom said my child is in his first, and then all these moms started talking about their kids being in therapy, and I was like, this is amazing, this is awesome, because really, guys, 100% of human beings really need to be in therapy. And why is that? It's because every day we're stressed out. Our jobs are stressful. Our home life is stressful. And most people would look at me and say, well, Dr. Brandon B, what you stressed out about? You got a great husband, you got a great car, you got a great house, you got a great income, you're doing what you love, you got great kids, and all of that is 100% true. I absolutely 100 plus percent love everything about my life. But guess what? It's a lot. It's a lot to, somebody can say, well, your job is easy. You sit down all day. I sure do. And you get paid a lot. I sure do. But guess what? Do you know that it's just stressful to have people looking at you saying, y'all don't even know what my cell phone looks like, my inbox looks like, the emails look like, from parents who say, I have heard about you. So-and-so has referred me to you. They told me if anybody can help my child, you can. Whoa, hold up. I'm flattered, but oh my goodness, how stressful is that? That you're coming to me. You've been to all the others, and now you've been to the rest, but they told you that I was the best? Whoa, that's a lot. That's stressful. Now, I am the best, and I am going to get their child better. But we're just talking about how stressful that is to know that people are even considering you in that light. One lady a week ago said, when we ended the conversation, now, she's from a different country, but she said, you are God. And I said, whoa, I think you mean I am God sent, because God I am not. I allow him to do a lot of great things through me, but him I am not. But that's just a stress on my job. My job isn't stressful, but just knowing that people need help. And on your jobs, people need help. It may be your coworkers that need help. It may be that you have staff who don't listen to you, or staff who don't come to work. And so if staff don't come to work, that means that you have to come and do multiple things. And let's just say you're in a service industry, and people are looking at you like, why are you taking so long? And why are you moving so slow? And why can't I get a table? I see you got 30 empty tables, but you're telling me your wait is 3 hours long. This can be stressful, right? So stress is all around us. And so you make up in your mind that you're going to go somewhere and you are going to get that taken care of. But people don't know where to go. That's what we're going to talk about. Hello, Priscilla. And Stacey says, me, all of us, yes, 100% of us can benefit from therapy. So if you don't have one, please go ahead and engage in getting one. But let's just talk about where you need to start. So once you realize, okay, I need some help, some mental health help, you first, honestly, want to go to your primary care provider. So if you do not have a primary care provider, doctor, nurse practitioner, or whomever, the first thing is that you need to get one. Someone needs to be monitoring your baseline levels, like your blood pressure, your cholesterol, your weight. All of those labs, they need to be obtained at least once a year, probably more, depending upon what illnesses you have. If you're a lady, you need to be getting your pap smear. So your family doctor, your GYN, somebody needs to be doing that. You need to be getting your eyes checked if you have diabetes, for example, or any other issues, family history of glaucoma. By the way, glaucoma is, number one in causing blindness, and it just sneaks up on you, literally by little by little. It literally just closes in on you until you're blind, and that is a blindness that we can prevent and slow. So make sure you're getting your eyes checked for that. So your primary care doctor is the one that you want to see when you first feel that something is going on. They are going to be able to ask the questions to figure out, is this emergent, urgent, or do we have time? And that is really a big issue to find out if we have time. Now, once you've decided that I want to see a mental health professional, there are some differences between us. We are not all trained the same. We do not all do the same things. You will hear me often speaking of getting a therapist. That is because I am not one. I am not a therapist. I do not do therapy. I do not even want you coming to me thinking that that is what you're going to get, because you're not. And you have we've wasted each other's time, actually, because you don't want what I have to offer, but somebody else wanted that spot. So that is an important first step to figure out, what is it that you want. Do you want to talk to someone? Or do you feel like we're beyond talking? I've already been in therapy, talk therapy. I need to go to the next step. But your therapist is going to be the person who is going to talk to you about life. They're going to help you get through grief. They're going to help you get through stressors in life. They're going to help you get through changes and losses, divorce, death. They're going to help you. There are people who just want to go and have somebody help them get through what is my next step in life, right? We call some of these people coaches, but life coaches exist, a little bit different on what their training and background is. So you may need to get some references, do some research to figure out what they are. But a therapist, okay, your licensed therapist will have gone through some standardized testing, and they are going to be able to offer you contrary to what people believe. They are not giving you advice on what to do, but they are helping you to gain insight so that then you can make good decisions about what it is that you need to do. I see my first lady, Miss Young, here. Thank you so much for joining. I have not forgotten you. I need to call you. We've got Miss Christina Smith. Thank you for watching as well. So your therapists are going to just help you to cope, get some coping skills, work through a particular situation, and it may be that you just go get checked up 2 or 3 times a year. Or you may be dealing with something, a loss, a death, grief, that you really need something intensive for about 6 weeks, and then you won't need them again until you just need to check in and get checked up and checked out. But you need to have that person on your team, because when stress comes and life comes at you fast, as my mama says, and it will, you've already got somebody that you've established a rapport with. They are going to help you through assignments, through various techniques that have been long studied and proven to be effective. They're going to help you use all of those techniques to then get through whatever the particular situation is, or challenge, or just talking to somebody. Some people will say, well, I don't have anybody to talk to, because everybody that I talk to will tell. And that can be, an uninvolved third party rather, that you can tell, and they won't tell. They don't know your friends. They don't know your family. So you can just spill the beans and tell your story to them in a way that is not judgmental, because everybody in the back of their mind, your friends and family, they might be judging you, right? Unintentionally, but that's what they do. And you can always guarantee that whatever it is that your therapist is coaching you through and working with it through is going to be sounded advice that's not going to get you put in jail, because that is what we want to do. So your therapist want to do is talk. That is a great place to start. you should see a therapist. We had Crystal Mullins on here earlier. There are several others. One of the best places to start is to go with your insurance. Now, do you hear me now? Do you hear me now? You all hear me now? All right, awesome. So you hear me now. Very good. So we've got what your therapist is going to do. The next thing you may say, my child is having trouble reading. Very good. Mama says, I hear you now. Perfect. So, very good. Thank you so much, Priscilla. So, you may say, I know what a therapist is. I'm all over that. Everybody in the family's on therapy. We're doing couple therapy. We're doing individual therapy. We got parent behavior therapy, because that is something that you may find that you need if you and your child are having challenges with them following your instructions, right? Children with ODD. That is an excellent type of therapy that is beneficial for changing their behaviors. So you may say, we've got that under control. But I think something is going on. The teacher is telling me that my child is having trouble reading, trouble learning, trouble staying in their seat. We still aren't ready for medicine, but I would like to know what this is that is going on. Then you may need to see a psychologist, because your child may need psychological testing. Now, adults may have it too. Sometimes that we use psych testing in adults, one of the ones that comes immediately to mind is when we're talking about the elderly people who may be suffering from dementia. And so we may want to know, can they still live alone? Can they still drive? Are they still able to pay their own bills? Or should they have assistance to drive them, pay their bills, live with them? Do they need to go in a nursing home? So getting some psychological testing is a great way to know if your elderly loved one is able to complete these tasks and to do so safely. Your child, though, can get psychological testing to figure out, do they have ADHD? Do they have oppositional defiant disorder? Do they have an intellectual disability and a lower IQ? Do they have a reading disorder, a math disorder? Some typical or common reading disorders could be things like dyslexia, for example. And so we need to know that, because that may be the reason that they're not performing well in school. But we would only be able to get that information by doing psych testing. For your students, the school is a great place to start. It's going to be covered, right? But it may be a slow process, just because there are not enough in most of your school systems to be able to get to your child in the 1 or 2 weeks that you want it to happen. If you have not noticed, though, all of mental health these days is pretty much jam-packed, and there is going to be a wait. Now, if you decide that for your child or for yourself, you want to go into the community and get someone to do your child's testing for you, a primary psychologist, for example, then you should probably be prepared, depending upon your insurance, to pay anywhere from $1,000 to $5,000 out of pocket to get it done. Now, I know what you're saying. Dr. Rudolph Bowling, Dr. Brandy B, Dr. Rudolph, Dr. Bowling, we don't have that kind of money around here. But I can tell you, if it is something that is definitely a priority to you, it may be worth it. Because having an appropriate diagnosis is the beginning of anything when you're considering having an appropriate treatment plan. If I am treating your child for ADHD, but your child also has a reading disorder or just has an intellectual disability, and so in fact, your child does not have ADHD, but your child just does not understand the lesson, then the only way that we're going to know that for sure is to get psychological testing. Sure, on my evaluation, there are some things that I may notice that make me concerned about there being an intellectual disability, but we don't know that for sure, and we certainly don't know the severity until psych testing is done. So psych testing is a very important step in aiding with the diagnosis of and ultimately the treatment of any mental illness. Your psychologists also do therapy. That is what they do as well. So it's just a preference as to whether or not you want a therapist or a psychologist to do your therapy. But either way, they're going to be doing the same skills, same evidence-based practices that have been studied for a very long time and have been confirmed to be effective when you're actually doing them consistently and with great detail. All right, so that takes care of your therapist. That takes care of your psychologist. So then you're probably asking, well, what the heck do you do then, Dr. Brandy B? Well, I'm glad that you asked. I am a psychiatrist, right? And so people always get confused, psychologist versus psychiatrist. The one thing that psychiatrist can do that psychologist cannot is treat with medications. Psychiatrists are medical doctors. We either have an MD or a DO, mostly in this country. We either have an MD or a DO, mostly in this country. Are you still able to hear me? Are you still able to hear me? Mama said sound, but can you hear me? Can you all hear me? Making sure everyone can hear me. Because we don't want to just be over here talking and you can't hear. We want you to get this good information. All right. Can you hear me? Yes, very good. Okay, so a psychiatrist, thank you all so much. Thank you all so much. So a psychiatrist can treat with medicine. A psychologist gets the gist of medicines. Get it? Psychiatrist can treat with medicines. A psychologist gets the gist of medicines, but they cannot treat with them, okay? And so you need to ask before you make an appointment with someone, will this person do therapy? Will this person treat with medicine? What is their focus? Because my staff is quick to tell you, if you don't want medicine, that is fine, but she does not want to see you. And it sounds harsh and it sounds blunt, but people are like, well, we heard you're the best. I am the best, but I have to reserve the best of me for those people that want it. Because let me tell you what happens. What happens when someone comes to me and they do not want medicine and they are adamantly against it and they think that medicines are from the devil and are evil and I have to be the red shirt, red eyebrow, red earring wearing devil herself, is that it takes a lot out of me and I feel kind of slimy in trying to convince them. I don't like convincing people of things. That's why I spend so much time on Focus on It Friday educating people. So if the education is there and you still don't want it, that means that you're not ready yet for what I have to offer, and that is okay. But when you come to me, I've already done the prepping. I've been prepping people since May of 2020. If they don't want what it is that I say maybe, something going on with them or their child, then they're not ready and they don't need to come see me. You can listen to my live streams and figure out what ADHD is and what several other common mental illnesses are. You don't need to book an appointment with me for that. When you book an appointment with me, you're booking an appointment to now go to the next level. We know what it is. We think our child has it. We think we have it. We're coming in to see if we do, and then we're ready for the next step. So make sure that before you book with anybody, you know what they use as their primary treatment tool. And if that happens to be medicine and you're absolutely adamant that you are against it, please don't book with them. Go and book with somebody else who says that they will do whatever it is that you're looking for so that you and they get the best usage of their time and your time. That's very important. Okay, so psychiatrist, more than likely are going to be treating with medicine. Make sure that you get clarity on what it is that the psychiatrist that you're booking with is going to do. Now, there's another group. There are nurse practitioners. I want you to be aware that nurse practitioners now can get a doctorate. And so that means that they can call themselves doctor. They are doctors of nursing, and they will tell you, this is nothing against nurse practitioners. I have some. I love them. They're fabulous people as a career, and also the ones that I have. But our training is not the same. I am yet to meet a nurse practitioner who has done residencies in and has been board certified in pediatrics, adult psychiatry, and child and adolescent psychiatry. I was at a training in the fall that was put on by the Alabama Board of Medical Examiners. What they said was that nurse practitioners get about 500 hours, I think I remember. Physicians get many more. I had a 5-year residency and still have seen, I don't know how many patients, 20,000 at least, okay? So our experience, our backgrounds, our exposure, and our approach is the same. Your nurse practitioner approaches you from a nurse's perspective. Your physician approaches you from a very different perspective. Nurse practitioners are great. They are absolutely great. But I just want you to be aware that if the person's name is doctor, they may still be a nurse practitioner, and that's okay. But I just believe in being very transparent about what we are working with, because our trainings are very different. That is not to slight anyone. It is not to elevate anyone. It is just to state the facts that we are different. But that is an option for to get your mental health needs met, okay? As I told someone, they were comparing me to a nurse practitioner that they have on staff, and I said, respectfully, we are not the same. We are not the same. So remember that going forward, and I hope they didn't take any offense to it, but we're not the same. Just like, with pediatrics, I don't see pediatrics every day. So I'm not offended if a pediatrician were to say to me, who is also board certified, that they, for example, see a lot of diabetes and they know more about it. Have at it. But you don't see as much ADHD as I do, and so we're not the same. It's not to mean that anybody is more or less. It's just that we're not the same. All right? So those are our 4 types of mental health providers. You got your therapist. They do talk therapy. Absolutely amazing. You've got your psychologist. They can do testing and also talk therapy. They're absolutely amazing. Also, under your psychologist could be a psychometrist, and you will oftentimes find school psychometrists to help your psychologist out with some of the testing and other things that need to be done. Then you've got your nurse practitioners. Absolutely amazing. You can check them out. They, as far as I know, are not doing any therapy, but they can do medications. And then you've got your psychiatrists. Your psychiatrists are going to be doing either, most psychiatrists are going to be doing medication management, but some of us do therapy. The therapy that we do, or that I do, is in large part with my sessions where we're talking about medications, because sometimes issues may come up that we can do a little bit of therapy with right there on the spot. But if all you want is therapy, a psychiatrist is probably not the way that you are going to want to go. A psychiatrist is not the way that you're going to want to go. We also do therapy, but like I said, that is not our primary job. All right. Hopefully that clears things up for somebody out there who was like, what do I do? What's the difference between the two? Remember, a psychiatrist is a medical doctor. We can treat with medicines. Okay. A psychologist gets the gist of medicines. They may even have some training on it. I don't know about their training, but they cannot write them in most of these United States. All right. Most states in the United States, they cannot write medications. So they may say to you, have your doctor to give you this class of medicine or that class of medicine. And your doctor may say, I don't think that class of medicine is right for you. And I don't care how much you trust them, know that they are not medically trained. And so that is not their background. And again, these are not to point out any differences to slight anybody, because we all have our strong suits. This is just to say what a person is not trained in should not present themselves as being comfortable with, and many other things, right? But we do, no matter where you start or no matter where you go, we want you in this month that is full of stressful things, right? Being a woman in medicine, being a black person, period. Being in the month of love, you're trying to figure out your love life. Being in a month where it's Super Bowl, you've bet all your life savings on a game. You try to figure out if Rihanna is going to perform as well as some other people have in the past. All this stuff got you stressed out, right? Then your heart condition, other medical conditions, right? They all have you stressed out. You're a woman who's had a heart attack. You're trying to figure out about life after that heart attack. These are all stressful things, but they can all be overcome if you get your mental health in check. Remember, guys, everything that you want to do in life starts up here. It starts in your mind. Once you tell your mind that you can do it, the sky's the limit. There is nothing that can stop you. But you have to want it, you have to believe it, and you have to tell yourself that it is so. Your words are so important. You know, I will stop being around a person who is negative all the time, because that energy, I cannot have that energy even existing in the place where I exist. So I have separated myself from people who are always negative. You give them a compliment. Oh, I really like that dress. And they say, girl, these old rags. I didn't ask you about how old they were or how you viewed them. I simply said they were pretty. I love the dress. All you have to say is thank you. You're just letting that negativity creep in. And soon you will find that everything about your life will be negative. So you better grab life by the horns, hold on as tight as you can, whirl it around, swing it, and don't let go. Because that is what we want you to do. If your children are having problems, you know, you've got to start speaking positively about it. We're having problems now, but we won't for long. We're getting better. Just start saying, we're getting better. Even if it's not getting better, it's getting better. And you know that they just called you to come pick them up from school. It's getting better. At least they didn't, they called you at 1 o'clock today. They've been calling you at 10. So guess what? It is getting better. Your marriage is on the rocks, but it's getting better. It could be getting better because it's going towards divorce. That may be the best thing for you. I don't know, but happy Valentine's Day to me as a single woman. We just got to learn to make it positive. Make it positive no matter what. Reduce the stress, and above all, go and seek help. Go seek help. Talk to someone who can help you through your situation. And remember, you're not alone. 100% of human beings can benefit from therapy. We all do it. We all need it. And I want you to be blessed. That's it for this weekend, guys. I want you all to have a great weekend. Make sure that you share the video. Make sure that you give a little blurb at the top if you want to. Make sure that you're inviting somebody to watch Dr. Brandy B, where we're always giving you good information and letting you know what your options are as far as getting your mental health in check. This is a great month to love on you. We talk about love in this month, but make sure that you're loving on yourself primarily, because there is no greater love than the love that you can have for yourself. All right, guys, I'm going to get out of here. I am Dr. Brandy B, your triple board certified pediatrician, adult psychiatrist, and your child and adolescent psychiatrist. Board certified in all three, ADHD expert, author of the best-selling book, Shine, Understanding ADHD So Your Child Can Be a Star. And I am the one who restores hope, who helps you believe that you and your child can be successful in the classroom and in life. If you need me, don't forget to hit me up in my inbox at Dr. Brandy B. But if you are my patient, please do not do that. Call me at the office where my lovely assistants are standing by to help you with whatever need it is that you or your child have at the time. I love you all, and I appreciate you all for being the best part of Dr. Brandy B. Go ahead and learn something about a black person today. Go out and just ask them something. Don't offend anybody, but we're pretty nice people. So learn about us and learn how we can make your life more exciting. I love you all, and I'll see you next week. Have a good one. Bye.